300,000 people will automatically move over into Medicaid, full Medicaid coverage, on day one when we flip the switch. This is huge. These are all people that don't have to touch county systems, and they don't have to burden already overburdened county DSS offices. 300,000 people will have immediate access to health care. Expanding, yeah, all right, thank you. That's clap-worthy. So what a lot of people don't understand is how complex an operational process that expanding Medicaid is. It requires state and federal authorities, which are not easy to come by. They're 100-page documents with the feds. It requires public comment periods, of which we've already gotten several hundred responses. It requires notifications to our tribal members and to other people. It means updating our technology system so it can suddenly handle hundreds of thousands of new applications, assign these people to health plans, make sure that they have a primary care provider, mailing hundreds of thousands of cards out and helping people understand what their new benefits are. It means that we need to find the other 300,000 people, not the ones that are going to turn over on day one and go right into the program, but the other 300,000 people we think we have in North Carolina that will qualify for expansion and help them go through the enrollment process. All this at a time when our counties are literally drowning in the amount of work with the redeterminations and struggling through that workforce crisis that we all have. One of the most important things that I want you to take home today, out of all the things I'm going to say, is to understand the state's perspective and position on enrollment. We think there's a way to do this that will really dramatically simplify the process and get people through much faster. If a person goes to a DSS office or calls to do an enrollment on the phone, it can take months for that process to finish, because a lot of the times there are fits and starts. They show up, they have part of the information, they need to come back with more information. Meanwhile, they've had a job change and their schedule changes and they get lost to follow up. A lot of things happen that make this process kind of lengthy and timely. Now we have the redeterminations on top of it, so we expect that process is going to have an even longer tail potentially. But if people go through the electronic system we've built called ePass, write that down, and they submit their application entirely at one time complete, they might have coverage in a week. It's that fast if they qualify through this ePass system. It's a game changer for everybody. It means counties who are already underwater don't get more work to do. It means people with real diseases and real suffering get access to health care faster. In Western North Carolina, that means food, housing, and transportation supports through our Healthy Opportunities pilots. Some of these people have been getting primary care through safety net providers, free clinics, FQHCs, but maybe they've not had access to the specialty care they needed, to procedures or surgeries. That's going to be undone the moment they have a successful application go through the electronic system. You might wonder why I keep saying complete application. The challenge with ePass is that once you start the application, if it's not completed right away and completely, it goes into the county DSS system, and it starts creating a work list for those county workers. And that's going to add to the backlog of all these other people that are in line ahead of people. But if someone starts the application and completes it at the same seating, it can go through something called straight-through processing. And it zips through the system electronically and does not touch a human being. And then they get Medicaid quickly. And they get their card soon, and they are engaged in care. This is really, really important. Most people don't do that. Right now, what we're hearing from counties is only 10 to 15% of the applications actually go through that straight-through processing because it happens in fits and starts. And once it starts, the county is on the hook for following through with that application. And so it's not going to be as streamlined and seamless. The harder truth that I'm going to share with you today is that we may not hit our October 1st date. We may not hit a 2023 date. If I'm totally honest, I'm a little worried right now that we're not going to get expansion. It's a shame that while we've been working around the clock at the department and you guys have been working around the clock in your communities, a lot of our legislators are out traveling for conferences and on vacation, and so they haven't gotten a budget done. It's a waste that every month we don't expand literally hundreds of millions of dollars that could have come to North Carolina with no strings attached are not coming to North Carolina. Dollars that could be building up our economy, that could be helping rural hospitals stay open and not shuttering their doors. It's a waste, but really it's tragic. It's tragic that people are continuing to suffer for lack of access to care. that we could deliver overnight. 300,000 people we can flip a switch and have on Medicaid the day that we get the approval. These are people that are shopping with you at Ingalls, they're singing next to you in the choir, they're growing the produce that you're eating at your tables. I know I'm supposed to be standing up here as a bureaucrat that's not supposed to say anything spicy, but the truth is I'm a doctor first, and I can't undo the memories of the people I've cared for, of holding Ronnie's hand while he was dying from liver failure, 50 years of age, of Mary when her brain tumor meant disabling headaches, but she couldn't get them treated and she lost her job, of Paula who had to make the choice of buying her insulin or paying for gas so that she could take her grandchildren that she had recently gotten custody of to their daycare. People like Jerome, dead at 50 with colon cancer, Maria, dead at 45 with breast cancer, Waylon, blind from complications of untreated diabetes at 40. All these people, all these stories. To quote Martin Luther King Jr., the arc of the moral universe is long, but it bends towards justice. I don't know what the legislature's going to do. I don't know if our supermajority can agree on a budget. I don't know that the governor's going to sign it into law if they do. I don't know if they could do the simplest fix, which would be just decouple expansion from the budget. It doesn't require the budget. It could be a one-sentence bill that goes right through tomorrow. I don't know what's going to happen. But I do know that it's going to take all of us to get there, to get people access to the resources they need and be ready to support them, as all of you have been doing, probably alongside me these last 10 years as we've been waiting for expansion. So thank you for being here today and learning more, and thank you for serving your communities and helping us get this done.
All right, if y'all will join me in just another round of applause for Dr. Dowler. Thank you for your leadership. When I think about the possibilities of what is possible for the people here, both right here in Western North Carolina and across this state, those folks that desperately need Medicaid, knowing that you are there in a leadership position, Dr. Dowler, gives me hope. And I know that there is so much more to do. So thank you for those remarks. Thank you for really helping us to see what is at stake. And for being here with us today and calling us all together to do this work. Part of Pisgah Legal's mission is to really help people improve their lives through their basic needs. And wanting to bring you all here together today to talk about what is happening with Medicaid, what is our community doing, what partnerships already exist so that we can continue the work that Dr. Dowler was mentioning. It has been 10 long years, but we're not ready to give up yet. We know that we can really see the changes that need to be made. Now, Dr. Dowler mentioned a couple of things in her speech, and I want to just kind of set the stage a bit for us together to make sure that as we're talking about all the different pieces of Medicaid, that we just spend a few minutes kind of digging into these different issues and how they all work together. So there are really three key issues affecting people who either are on Medicaid or need Medicaid right now in the state of North Carolina. The first is Medicaid transformation. That also is known as Medicaid managed care. The second is the unwinding or Medicaid terminations with the end of the COVID-19 public health emergency. And then finally, of course, one of the most critical topics, Medicaid expansion, or what's also referred to as closing the coverage gap and getting the lowest income people in our state and in our communities on Medicaid. So let me start with just a few points about Medicaid transformation. Now, this is a change that's been ongoing for several years with the Medicaid program. This was the move from the state of North Carolina, the Department of Health and Human Services, administering Medicaid, to moving this to a managed care system with prepaid health plans that are otherwise known as health insurance plans. Most Medicaid programs have shifted over the last couple of years into this model. Not all, there's still a few programs left and some complexities with that. But the bottom line is that the program has undergone a pretty massive shift for many of the people who are on Medicaid. This means that now they're negotiating with healthcare plans in and out of network coverage, making sure that their provider is covered under their plan and the choices of plans. It's been complicated. Pisgah Legal Services is grateful to be a part of the North Carolina Medicaid Ombudsman Program, which the state has put together so that we can help the beneficiaries who are on Medicaid understand their options and navigate this complicated system. One of the really exciting aspects of the transformation system is the Healthy Opportunities Pilot. This is a pilot program that is first of its kind here in North Carolina that the state has created that is looking at using Medicaid dollars in creative and innovative ways outside of the traditional ways that you would consider paying for health coverage. So as you can see on that slide, thinking about how do we impact someone's health, not just through kind of the four walls of the provider office, but what about their housing and the impact of their health and housing? What about food, transportation, their personal safety, intimate partner violence, and a host of other services, including medical and legal supports, where Medicaid dollars can be used to pay for that, to improve the health and the well-being of the person who's on Medicaid. So this is an exciting time to pilot this program and to see what is possible. What it means for both our state and across the country is that if we can show we know that this works. If we can now show this and really show the pilot and its effectiveness, we could change the Medicaid billing system to fund all of these services in addition to traditional medical care. Terminations is something that Dr. Dowler was also mentioning, and that is something that has been in the news recently. Medicaid rules changed in April of this year. At the end of the public health emergency with the COVID-19 pandemic meant that folks who were getting what's called continuous coverage, they weren't having to go through kind of an annual recertification process. They were able to keep their coverage during COVID-19 when we knew people need their health care. We don't want to see anybody losing it who was already on Medicaid. That is ending, and now folks have to go through a recertification process. This means that they're at risk potentially of losing their coverage. Now, for some folks, they're no longer eligible and they might be able to transition into the Affordable Care Act. For other folks, it means that they need to get that paperwork in that Dr. Dowler mentioned. They need to update their information, they need to respond to mailings and other things from the department so that they can recertify and keep their coverage. And it is incredibly unfortunate that we haven't been able to sync this up with Medicaid expansion. So we will continue to see folks who are rolling off that could be covered, but for our state not being in a position at this moment to implement Medicaid. At Pisgah Legal, we have attorneys who are available to help people through that process if they are being terminated. And so we encourage everyone to make sure that you're making referrals. Oftentimes it's something that we can help with, or we can at least explain to someone what their options are. And finally, going back to Medicaid expansion, the biggest topic that we're here today to talk about, the one that's in the news and that we are covering, and I think anxiously awaiting to see what happens next. Now, we call it Medicaid expansion. I like this visual from the Kaiser Family Foundation because I think what it really does is explains that it's not so much expansion, really, it's closing a gap that has existed for decades with the Medicaid program. Many people, when they hear Medicaid, you think, well, Medicaid covers low-income people. It is the largest safety net healthcare program in our country and right here in our state. But the truth is, Medicaid only covers a certain group of low-income people. There are between 500,000 and 600,000 people who have simply been left out of coverage. They are low income, but they don't fit into this category that it has to be attached to their being low income and being an older adult or being disabled by the Social Security disability standards. So you see that middle orange coverage of this umbrella, those are the folks that are left out. They don't qualify for Medicaid right now. They're very low income, often as we know, the people who are working and in service industries, cashiers, checkout, folks who are working minimum wage jobs, part-time, pulling things together, they don't fit into the category and they don't get Medicaid. And they don't earn enough money to qualify for the subsidies under the Affordable Care Act. This has been a crisis for the last 10 years of seeing people here at Pisgah. We've actually met with folks in our ACA program where they come in hoping to get coverage, and we have to explain to them that, unfortunately, you are very low income. You're too low income to qualify for the subsidies under the ACA, in fact, but you also don't qualify for Medicaid right now as it stands. And of course, I think most importantly, we can look at the visual, we can hear the numbers, but it's also, there's a story. There's a human being behind each and every one of those numbers. And one person that we've been working with at Pisgah Legal Services is Angie. And we have her permission to share her story here with you today. Angie is pictured there next to Judy Schultze, who is one of the social workers at Pisgah Legal Services. Angie is in the coverage gap. She makes too little money to qualify for subsidized ACA insurance. She doesn't fit into the category of being disabled or being the parent of a minor child in her household, but she lives with many chronic health conditions and desperately wants to have a primary care doctor and be able to be seen routinely. She has had to go to the emergency department for what would be a fairly basic test and antibiotic treatment if you went to your primary care provider. But because she doesn't have a primary care provider and doesn't have health insurance, she ended up in the emergency room with over a $14,000 bill for a CT scan to diagnose this infection. She doesn't have transportation. She has to make choices between food and medications. And unfortunately, Angie's story is like so many of the other stories. We know that many people have lost their lives as they've been waiting for Medicaid to expand. One of the quotes that Angie shared with us that really resonates with me, and I think will with you as all, is that when she was talking about Medicaid and what it would mean for her, she said, Medicaid is the key that unlocks all the doors. And so when we think back to what it means to be able to have quality, affordable healthcare coverage, and for someone who is low income, who's experiencing many of the burdens of poverty, the impact and the resource that having the access to care can be for Angie and for so many hundreds of thousands of others here in our communities across our state. Couple of quick key facts. Medicaid expansion means that adults 19 to 64 with incomes up to 138% of the federal poverty level will become eligible based on their income. In very specific terms, that means someone who's making just under $20,000 annually as a single person will qualify for Medicaid. They will receive comprehensive coverage, the same quality coverage that people who are currently on Medicaid receive. And the news is ever changing, but we continue as legal services and with our partners to be hopeful that we can see some change happen, and that this October 1st deadline, or October 1st date to begin the implementation of clicking the switch and then going out and helping more people to get enrolled still can be a reality. So Pisgah Legal Services is here to help, and we are really grateful to be in a position to offer a variety of services to support people who need Medicaid. Our Medicaid enrollment assistance is included with our work under the Affordable Care Act. And we are trained on e-Pass, and so we'll be working hard to make sure that those applications go all the way through. And then, of course, we've got a host of other services that we provide. We're also really proud to partner with so many different important organizations across Western North Carolina and here across the state. We partner with Mountain Projects, and we've got some folks from Mountain Projects here in the room. Between us and Mountain Projects, we are able to cover 18 counties across Western North Carolina for the ACA and Medicaid expansion. We stand ready to do that the day that it starts. And I do need to recognize and thank the Dogwood Health Trust for their generous support in standing up that program so that we as a community can be prepared for the next steps here. So I would like to invite now our community panelists to join me on stage. We've got several different folks here representing the community who are going to share more information about what is happening in the community from their perspectives. So just give us a moment to get set up here, and we'll go into the panel discussion. Thank you. All right, panelists, thank you for joining us. What I'd like to do is start just by welcoming each of our guests here on the panel. I'll ask them to provide their name, introduce themselves, the organization that they're with, and tell us just a little bit about what their organization does here in the community. I think we'll just start to my immediate right and go down the line. So I'll start with you, Glenn.
Great, thank you. All right, how's this? Good? Okay, I don't want to overdo. So my name is Glenn Wise. I'm the programs director at Manna Food Bank. I think most of you will know something about Manna. We certainly, kind of the core of the business is to source food, store food, and distribute it to 250 some partner agencies across the region. We service the 16 westernmost counties in the state. However, what you might not know is that we're also in programs, which is the department that I lead, focused on other types of support to provide to our neighbors. We do SNAP enrollment, SNAP assistance, or assistance with SNAP applications and other public benefits. We also have a health and nutrition team that really focuses on improving the quality of the inventory that we provide to our neighbors and doing nutrition education, those sorts of things. And then we're also very involved in healthy opportunities, which we're really excited to be there.
Thank you, Glenn.
Good morning, everyone. My name is Kim Wagoner. I'm the Chief Executive Officer over at Winches, Western North Carolina Community Health Center. We are a federally qualified healthcare center that our mission really is to provide high-quality care to vulnerable populations, but just anybody in the region that wants to have health care. We provide primary care, dental, behavioral health, case management, and pharmacy services. One of the things I think we've started along with what Manna's doing, we are heavily involved and are a HSO with Healthy Opportunities, and as we talk today, we can share some of the things that we've been doing with our Medicaid beneficiaries and the impact that HOP has had on their lives. So yeah.
Hi there, my name is Christy Rhodes. I'm one of the program managers of the North Carolina Medicaid Ombudsman. I will talk a lot more about our program, but I should probably begin by explaining what an ombudsman is, because that word is unfamiliar to many people. An ombudsman is an advocate or representative for people. Our program in particular is an advocate for North Carolina Medicaid beneficiaries. We are a statewide program. I'm based in the Western region here in Asheville, so we cover the 19 westernmost counties for our outreach. And we are here to help people understand Medicaid transformation, help them access care through their Medicaid plans, and help them to resolve problems when they have them. Thank you.
Thank you.
And I'm Hannah Van Regenwarder, and I get to serve with Dogwood Health Trust as a grants officer. Anybody here have a grant from Dogwood Health Trust? Yay, about half of you or more. I also had the privilege of working with Jackie, with Jan, and her team at Mountain Projects, with folks from CareReach, our FQHCs, On Track Financial Services, and Care for Carolinas, on trying to build the readiness for increasing healthcare access, for Medicaid expansion and beyond. So I am really happy to be here today and hoping for good news soon.
Good morning. Is this okay? Mm-hmm. Yeah, thank you, Jackie. I'm Nicole Dozier. Oh, thank you. I direct the Health Advocacy Project at the North Carolina Justice Center. We're located in Raleigh, but we are a statewide organization. It's really my pleasure to be here today. We have traditionally worked with partners across the state, including in this area. But our work really is to eliminate poverty in North Carolina. And I went to the Justice Center 26 plus years ago and still working there to eliminate poverty. But one of the things that I wanted to stress is that there are many things that, many issues that people have, many strategies that we deploy to just attack poverty at its roots. And by getting people health coverage, that is really a great start. And so one of the things our team does is make sure that we advocate with the General Assembly. One of those things being actually at the federal level is getting the incentive into the American Rescue Plan Act, which is huge for us in this country. So just really happy to be here and share a little bit more about what we do.
Thank you. All right, so I'm going to start by addressing a question to a particular panelist, and then we'll have some others join in if you'd like to respond. But we've got a great group of questions here and want to make sure we can get through most of them. So let me start with Glenn from this broader community perspective. Can you talk about the benefit? Tell us a little bit, I'm going to do this two ways. Tell us more about MANA's work with the Healthy Opportunities Pilot. And then please share with us the broader benefit of Medicaid expansion for individuals in the community based on the populations you work with at MANA.
Great, thank you, Jackie. Great question. So we have actually been involved with Dogwood from the very beginning of the application for Western North Carolina to be a part of Healthy Opportunities in the state. And then we are currently providing services as a human service organization, healthy food boxes, healthy meals, those types of things. We're also providing support to Impact Health, as well as the network of HSOs throughout the region, which is an 18-county region. And yeah, it's just been extraordinary to see the impact that particular program has had on folks that we support, not to mention all of the housing and transportation and interpersonal violence and legal support that's happening as a result of the pilot. So yeah, really, really excited to see that expand across the state over time. In terms of the impact for Medicaid expansion, I think someone mentioned earlier, the bigger the pool of Medicaid beneficiaries, the bigger the pool of folks that can get engaged in Healthy Opportunities. So I see a lot of opportunity there around enrolling other folks in the pilot. I will share that this is not directly related, but one thing that we have seen in the work that we do with our school partners, I don't know if anyone has kind of noticed news coverage over the last several months, that there are many, I think 10 or 11 counties in Western North Carolina that are now able to provide universal meals. And that's a significant change from what that program has been in the past. And the primary reason for that is a change at USDA and DHHS level that allows school districts to include Medicaid enrollees in calculating their eligibility. And so we went from no one in Western North Carolina being able to provide universal meals to 10, 11, and now I think it's maybe even more than that. So again, that then expansion of Medicaid toward getting school districts to qualify for community eligibility provision is very significant. So.
Thanks, Glenn. Kim, can you tell us more about Medicaid expansion and how that will improve access to health care, both for the people who are currently on Medicaid as well as the folks who would be able to be eligible for Medicaid?
So currently, for Winchester, for our population, about 55% are uninsured out of our 13,000 patients. So we really see, and in my experience in other states with Medicaid expansion, about 40 to 50% of those folks will be able to get on to Medicaid expansion. So what does that mean for them? And then what does that mean for the larger community is that even though they have access to health care, primary care through a federally qualified health care center that offers them a sliding fee discount, that doesn't help with when they need to go and get a CAT scan. That doesn't help when they need to go and get their colonoscopy if that's the age. Some of those preventative services that our primary care providers are, saying that this is time that you need to do it, or those kinds of things, they just simply didn't have access. So now they're going to have access, and that means we can find and diagnose things earlier and then help them become and get as healthy as they can be. One of the things I saw in Illinois, and we saw in other states, is that the healthier your population is, then all of a sudden they're back to work. They're contributing. They are doing what they need to make sure their lives are going forward. And I think that's going to be one of the biggest impact, is that we are going to be able to help them control or help them. I always like to say we need to help them manage their disease and their disease not manage them. And so if we can help them have the tools, the medications, the testing, the health coaching, the lifestyle coaching, getting food, access, transportation, in the end, we're going to have a healthier population across the board that may help us address some of the workforce issues that we're all dealing with. So I think that's going to be it just cascades going forward.
Absolutely.
Yeah.
Well said. Thanks, Kim. Nicole, so we're hearing about the challenges with Medicaid expansion. Can you talk to us more about those challenges and what steps can be taken to address them?
Yeah, thank you, Jackie. The biggest challenge is that the North Carolina General Assembly has not enacted Medicaid expansion. So it's very simple, as you've already heard this morning. No, we do not, she said, we do not need to wait. We'll tell you that over the course of a month, as you said, 9,000 people are losing coverage, but I want you to understand that also people in the coverage gap, about 1,100 people have been dying every year due to just being uninsured, which I call it a disease. And so the challenge is we have to connect with our lawmakers, with our representatives, and let them know that we no longer need to wait. I will tell you a story of Deanna, which is African-American woman who ended up having a baby who was stillborn because she was not listened to. And the tragic thing is that once her baby was born and then born dead, that her Medicaid went away because she had Medicaid for pregnant women. If Deanna had had Medicaid, we have done this when we should have over a decade ago, then she could have still been here today, but instead she died in her 40s. And her doctor, Dr. Green, will be at the press conference tomorrow, where grassroots communities will be at the General Assembly asking lawmakers to not consider whether we should have video lottery machines, whether we should have casinos in North Carolina, whether we should just make sure that our friends and our neighbors can have access to health care that many of us have. It is a shame. So what we can do is let them know that we're here and we need them to stop gambling with our lives.
Thank you, Nicole. This next question I'll pose to you, Hannah. What role will community partners, including many of the organizations that are represented right here, as well as those who are joining us here today, what will they play in helping to make Medicaid expansion successful?
So the first role is responding to Nicole's encouragement. We've done a lot of educating the last few years. We need to do one last push to educate on the consequences of this. I'd like everyone at the last 4 tables in the last row to stand up right now. So, 20% of folks in North Carolina right now have medical debt. That's 20% of our folks are in those last 4 tables in this room right now. You may not know as much about medical debt here in the West because our former health system, Mission, was actually one of the best in the entire nation at charity care. And so our ratio of medical debt, folks, has been very, very low up until now. But through the rest of the state, we have some counties where it's up to 40% of the population has crippling medical debt, which when you're postpartum and you know you just lost insurance, you can sit down now, and your gestational hypertension kicks up, which mine last did. I almost died twice this spring having my baby in my 40s, right? If I hadn't gotten health care, if I'd been scared of losing my home, losing my equity, losing everything, you know, still got another bill last week. It's $115,000 so far. Thank God I have insurance, right? But this is a problem. Many women don't have insurance, and when your baby dies, you lose it. It's an injustice. So what can your role be? Number 1, speak up. Number 2, those of you who have Dogwood grants, and you're like, I wonder if we have any flexibility with our funds to get our folks cross-trained as Medicaid ambassadors. Talk to me. Talk to your grants officer. Would love to chat about that. Can't promise any new funds at all, but let's talk about being flexible with our current funds. For those of you who have community health workers, we have our new community health worker pre-app coming through in the next couple weeks. And if you want your community health workers to be cross-trained, to talk to your grants officer about that. We'll have our next cycle of funding early next year. Think about what you can do in your work and with your staff, with your employees on that front. Enrolling in Medicaid can be tricky. I think it's around a 10 to 15% success rate if you do the e-pass just by yourself without help. That can be very discouraging for somebody. But if your staff can be cross-trained with our amazing folks from Pisgah Legal Services and Mountain Projects, and they can get that done right the first time, that can be incredibly helpful for that person to get care right away. The next thing I'd have to say for community partners is talk to your people and see what organization you can be part of that can link you to what the efforts are going on with expansion. So Kim, right over here, is leading a wonderful group with FQHCs and community-based organizations that are meeting regularly and planning. I know I with Dogwood Health Trust and Kate B. Reynolds Foundation and others are trying to bring funders together to partner with the state to help with communication and outreach as well, because there are some gaps there. But we want to all work together, and so bring your peeps together. You're like, I'm not really directly related to healthcare. If you work with folks that are poor and need social services, frankly, you are, because health insurance access is a huge part of being well as a family.
Thank you, Hannah. I think we've all got some good ideas now about what we can do next. I really appreciate that. I want to take a moment and pivot to managed care and invite Christy for this next question. So managed care, and really talking about people who are on Medicaid currently, because we know there are folks here and listening who are on Medicaid and need support. So I've got sort of a 2-part question here, Christy. Talk to us about a little bit more detail about the role of the North Carolina Medicaid Ombudsman, and then what do people who are either new to Medicaid or going through the managed care process need to know about managed care?
Sure. Thank you, Jackie. So I think this is a really important point because we're talking about people accessing Medicaid, but if someone already has Medicaid and they aren't sure how to access care or where to start, that's where the North Carolina Medicaid Ombudsman really steps in and tries to help the Medicaid beneficiary directly. So we started, as was in the presentation, when managed care started on July 1st, 2021. That's when things got really busy with the Medicaid Ombudsman. Most Medicaid beneficiaries, so if you're working with people, most Medicaid beneficiaries are likely in a managed care plan as of July 1st, 2021. In our region, you probably hear about the EBCI tribal option, AmeriHealth Caritas, Healthy Blue, United Healthcare, and WellCare. There's another one that's Carolina Complete Health that's not available in Region 1 here. But if you're working with beneficiaries who have Medicaid and you hear those plans, you can pretty much rest assured, unless that's a Medicare plan, they're in a Medicaid managed care plan. And that's where the Ombudsman really steps in to help and assist these beneficiaries. Because as of July 1st, 2021, this was a brand new system. So I think throughout all of today, we've learned that Medicaid is complicated, and this added a new layer, a new atmosphere of beneficiaries to navigate so that they could access care. What we do through the Medicaid Ombudsman is really in 4 parts. The first part is to educate. So we help North Carolina Medicaid beneficiaries understand what managed care is, or help them learn more about North Carolina Medicaid in general. And we let them know about their rights and responsibilities within managed care in North Carolina Medicaid. As I mentioned, another word for ombudsman, when someone calls us, we quickly say, well, we're your advocate. So we advocate for beneficiaries. We help them resolve the issues so that they can get the care they need. And that may be as simple as, what phone number do I call to get an ID card? Or it may be as complex as, I've been dealing with this situation for 2 months and I don't know where to go now to access an MRI or find a new cardiologist. So we help them navigate everything from very simple information and education to really involved issue resolution that may last weeks, if not months. We also refer and connect. So we know that when Medicaid beneficiaries come to us, especially in the Western region, we want them to know about other programs related to social determinants of health. Here, making sure they're aware of the Healthy Opportunities Pilot, the ability to access a care manager, but also if they're facing an eviction or if they have no food on the table, we want to make sure that they are aware of places like Manna Food Bank or Pisgah Legal Services. And finally, another really important role that we play is that we communicate with North Carolina Medicaid and the Department of Health and Human Services. So in being the voice for Medicaid beneficiaries, we track issues and we monitor trends. And we report those to North Carolina Medicaid so that we can work together to resolve any problems that we see, any type of trends that may be happening across managed care. The next part, so someone who is new to Medicaid, or even if they're new to North Carolina whatsoever, one of the more difficult phone calls we get is someone who may be moving from Ohio and they want to transfer their Medicaid. So not only do we have to explain to them that Medicaid is a state-operated program, we are right now also explaining to them that North Carolina has an expanded Medicaid, so we get them connected to their local DSS office or ePass or an Affordable Care Act navigator. But that is something that's really important for people who are new to North Carolina in general to know. For those who are new to Medicaid, say expansion does happen on October 1st, it's going to be important to help beneficiaries navigate the managed care environment. They may be receiving a card in the mail from Healthy Blue, for example, and not understand what that is. So there are a lot of different entities involved with managed care. We have information here so we can share much more information on that if you have direct questions. But the North Carolina Medicaid Ombudsman, again, takes a no wrong door approach. So if someone doesn't know where to start, how to start, or they're facing a runaround, that's an excellent referral for us.
Thanks, Christy. So hearing so much about, the complexities, all the different moving pieces of this puzzle that is Medicaid, both for people who are on it and trying to use it, and for those who would benefit and waiting for their eligibility and the prospect of eligibility. Let me go back to Kim. I want to hear a little bit more. Hannah had mentioned that you're coordinating a collaboration with federally qualified health centers about expansion. Can you tell us just a little bit more about that?
So, one of the things, I am a transplant here as well, and one of the things that I have learned over the last 5 years of being in Western North Carolina is just how much we all work together, and we're all working together for the same cause. So with Pisgah Legal with Mike, we put together a group of not only our FQHCs, but different community groups like Age of Counseling, Dogwood, I can't remember they're all. We had about 40 people on the call, the first call. And we're looking at what does each organization have? Like we have navigators. Pisgah Legal has a large group of people that can help shepherd people through this process. But what is it that each community organization and FQHC can offer? What are their needs? Because one of the people said, we don't have anybody to help us in our office. So it's about learning about what we all can do together, whether it's in each individual FQHC office or social service agency. What can we be doing to do some community events? I remember when the Affordable Care Act went in place in Illinois, we were out in community centers enrolling people. So it's like, what can we be doing together and who needs what help? The other part of that is what kind of materials do we need to get out? As we've all heard of the complexity and of the e-pass, making sure that we have the beneficiary or potential person has everything they need. What is that message to get out to them? What is that education? And I have a feeling now after I had the opportunity to be with Dr. Dollar on Friday and hearing that again, we need a checklist. And it's a checklist that this is what you need to make sure that you have, and then you need to make sure that you have it all set before you even open up e-pass. The other part is we really need to help people understand, especially with healthcare providers, what managed care program are we contracted with? If they're, for us, like for our current patients, we're going to give them that information so that when it comes time for them to select, they know all the information so that they can stay with their primary care provider that they have a relationship with. But then it's also about what other kinds of things do people need to have in order to get through the system. So if you're interested, we are probably going to be having another meeting hopefully at the end of August. Mike has been putting together a survey to go out to the group about what their needs are, what they can offer. But the more the merrier. We'll learn through this as we go through the process. But please see me and we can certainly get you on the list.
Please. Yes.
Thanks, Kim. I just wanted to add a couple of other thoughts to that as well. As I mentioned, we do SNAP application assistance across the 16 counties we serve. And one of the things that we've learned in doing that work is to tap into the trusted individuals in the community. So as we've said, as I said, we have 250 some partner organizations across the 16 counties, and if we can educate those partners about the benefits of SNAP, and in this case, the benefits of getting enrolled in Medicaid, then they can almost become advocates, community advocates. And these are the folks that, the neighbors that are getting help with food, they know them, they trust them. We have tried so many times to send some outreach staff from Asheville into communities in the far west, and that just does not work. I mean, it works eventually if you take time and build the trust, but it really is, we found, depending on those people who are in the community to do any kind of education and outreach like this is critical.
Excuse me. You are so right. You are so right, Glenn, and so much of this is about building relationships. And Kim, thank you for opening up that invitation. I think we probably will find we have a lot of folks here today who are joining us who are interested, who do want to get involved, and again, thinking about how we partner and build those relationships here across Western North Carolina and how we see that across the state. Nicole, would you like to speak to what the Justice Center is doing collaboratively across the state?
Sure, thank you, Jackie. You know, we can't do this work alone, and so we help create coalitions and anchor them and have other people anchor them. You know, one of the coalitions that Hannah spoke about is Care for Carolina, which is one of those that we help create, but understanding that we will be doing work in a different way and have different partners in different direct actions. The other coalition that we have is called we call it HANK, we like acronyms, Health Action NC. So that HANK coalition is more about doing communications and direct action. So when we do vigils, when we do press conferences, when we've had things like funeral marches, you know, we had people who had lost their family members because of uninsurance, and they led a funeral march and then ended up at a vigil about just showing about the missing moments of that person's lives. That's what the HANK Coalition does. And then we have one called the People's Budget. And the People's Budget is about North Carolina having a budget that works for all people, not for some. And there are times when we all work together. All of us right now are working to get Medicaid expansion in different ways. And so on tomorrow at 10 o'clock in front of the General Assembly on Jones Street in Raleigh, we will be gathering there, and it's led by grassroots groups. It's led by people who are uninsured or have huge medical debt, and then one of the providers I spoke about. I will let you know that Penny is a woman who is from Charlotte, and I have permission to share her story as well, who had retinal issues and was able and had lost her vision for a while and does have her vision because of procedures that she had. But I will tell you that last week because we do keep up with we call them storyteller advocates, we do keep up with them. She let us know she had an episode and could not be seen because she had so much medical debt they wouldn't give her an appointment. So I will let you know that I did connect with a leader in the General Assembly. I wanted this person to know Penny's story. And we also have sent Penny's story to President Biden and to congressional members. And actually in one of the congressional hearings, well, a Senate hearing, the chair spoke about her story. So that's some of the work that we're doing with other groups. We in Raleigh can't get everywhere, but what we can do is build upon our relationships with lawmakers and other policymakers and take those stories in and do what we can. If you can't get to Raleigh, you give us the information and we can get there for you. Thank you. Anything else you wanted me to share, Jackie?
I think that was great. Thank you, Nicole. So I think we have run out of time for our specific questions here on the panel, but we did want to leave time to hear from you, our audience, questions that you have for our panelists. So Allie Wilson, our Chief Development Officer, is going to grab a microphone, and if you do have a question that you'd like to ask, if you would indicate maybe by raising your hand or even standing up, she's going to walk around and we'll pose a couple of questions now from the audience.
I just have a quick comment. So the transition to managed care has been challenging, understatement of the year. One of the positive things that has come out of a really difficult transition has been the ombudsman. Before, if people, providers or others had trouble, members, there was just this sort of vacant space where you tried to get help and tried to understand what to do next. And through the ombudsman work between our member ombudsman and our provider ombudsman, we now have a member harm system that automatically copies people in 24/7. We're on it trying to close care gaps, and that just didn't exist before. So with the challenges that came with transition to managed care, there have been some real positives for members. So I'm just super grateful for the ombudsman work.
Thank you. Thank you.
Hey, I just have a quick question about the Healthy Opportunities pilot. I mean, it sounds wonderful and really great things are happening. So what makes it not be a pilot anymore? What is happening to try and ensure that it continues?
Great question. Who would like to, Hannah, would you like to start on that one, or Nicole?
I can share briefly. So there is movement to continue the Healthy Opportunities program for 5 more years. It's contingent on a budget passing. But we've heard positive signs, at least from where I'm sitting.
Thank you for the question. I think each of the pilots have to, I guess, demonstrate success too. And so that way, I think if you can have successful numbers or data or stories about how it's impacted people, about how people, need the service in another county, but it doesn't exist because it's still a pilot, I think then sort of inspires folks who are in leadership to perhaps expand the program.
So in short, use NC Care 360.
Yes.
Did you have something to add, Glenn?
I can add to
Please.
that. So just last week, we had the first statewide conference for Healthy Opportunities pilot, and Amanda Van Vliet from DHHS actually gave some updates on plans for Healthy Opportunities in the future, and they have already begun work on renewing the 1115 waiver that with CMS that supports both managed Medicaid in North Carolina, but also the Healthy Opportunities pilot. And there are going to be lots of changes that they request as a part of this renewal, but she did share that one of those changes is going to be, or a request, I want to be really clear about that, a request will be to expand Healthy Opportunities across the state and hire additional network leads and cover the rest of the state. We'll see, but it's a possibility.
That's a great possibility. Thanks for sharing that with us. I just want to note, too, I think as we're sharing information, what we will do after today's panel and forum is we'll email out materials, reference materials, and links to the different organizations, the information that they're sharing, so that you all have access to learning more and seeing the materials that go along with Healthy Opportunities and managed care and the Medicaid expansion event that Nicole has mentioned that's happening tomorrow.
Thank you so much to Pisgah Legal Services and all the speakers for coming out today and doing this wonderful presentation. My question's probably best directed towards Christy. How can we get more outreach, better outreach from the managed care providers in the 7 western counties? How can we get people to do outreach past Asheville and come out to some of our events and activities?
Absolutely. I know for the ombudsman, I'm going to point at Melissa Lacey right here. We're very interested in doing that. It is always a balance for us because we have a statewide hotline and we have to be available. When someone calls the ombudsman, I'll back up and explain that. Someone presses 1 for English or another language or 2 for Spanish, and they're immediately connected with an ombudsman who opens a case for them. So a lot of our work happens over the phone, on our headset, but we are really interested in getting out, especially to the far western counties. I know that there are outreach Region 1 contacts for all of the plans too. So if that's something that we can help liaise for you, we can absolutely get some contacts for that. We're very interested in coming out, whether it's through a remote presentation. We've gone to food distributions, we've gone to backpack distributions. August has been a really busy month for us. So we are always looking for those types of opportunities. Thank you.
Jackie, can I weigh in a little bit on that?
Yeah, please.
So one of the roles we have in the Justice Center related to the prepaid health plans and managed care is to connect with the prepaid health plans and just see how things are going. So we just had a meeting with them last week, I'm sorry. But one of the things that we are happy to do is when we connect with them is to share what you're talking about, is that there needs to be more outreach and engagement. So we actually created a training with Pisgah and CCLA and others, and it's a 3-part series, and would love to make sure that we include that in our materials, but it's about how to hold an accessible meeting, how to take someone's story and not use the story to help the person and everyone else, And so we have a video of someone who's visually impaired who talked about how she uses Medicaid, but the things that she does is she gets mail to her house. Nothing, so how does she understand what's happening? So someone else has to then open her mail and be in her business, So happy to bring this up as we continue to connect with and train the prepaid health plans that agree to partner with us. They have said that they really want to get more people in the member advisory committees. And so we provided just, ideas about how we get people to meetings and things like that. So happy to put that up there on our list as well.
Thank you.
Norma Duran-Brown from UNETE. I have a question about joining the pilot, because at the moment all this was happening, UNETE was just formed, and we didn't have our 501c3 status, but now we have it. And we have been helping Mana Food Bank to overcome the waiting list, because we have Jose, our community health worker, highly trained in EPAS and everything else. At certain point, we were the organization using mostly Secure 360 in all Western North Carolina. Glad that more people is doing that. But how we seek more funding without Dogwood, which has been amazing with our youth group, to be able to sustain this community health worker, able to, in a couple of months, work through a 300 waiting list of Latinos applying for seeking help from Mana Food Bank. We need him to be able to be full-time doing that. We need also Berenice, which probably you heard in the state meeting. We share her with Haywood Christian Ministry, and she was able to enroll 93 people from Haywood County in the HOP program. We have the people that is connected with the community health worker, and other organizations have it too. I saw Kula people here, so you got the connections with the Latino community and other immigrant communities, but we need to be able to retain those community health workers full-time and with better packages, and I'm not negotiating how much we pay. Sometimes I heard from funders that we pay way too much, and my point is that nonprofits, we have to learn to stop profiting with the community service, the love we put in serving, the passion we put in serving, but remember that also we open our own wounds every single time we fail in serving somebody from our community. So please help us to keep these very valuable people that they are willing to reopen those wounds, but for what they deserve to be paid. There is not university or college that teach us to work in certain communities and be embraced and receive the information we try to provide. So I'm asking you all to just support us in seeking more funding and expanding our group. We had 32 community health workers originally. We went to 25. We still serving counting. We still paying people to support many of the organizations here, but now we are a team of 11. And it's getting harder and harder, but like I said, we can do it, just we need more support with funding. Thank you.
Thank you, Norma.
Thank you so much, Norma, for that. The original state investment in the pandemic community health workers was amazing. And UNITE, was the #1 Secure 360 user in the West. I got that straight from the state. You did beautiful, beautiful work, and you're still doing beautiful work. When I first started at Dogwood, I was like, oh, this would be great for, what a lot of money. And then when you're like at your 1,000th application, you're like, oh, all that money divided by hundreds of nonprofits doesn't go as far as you really want it to. So I think you're aware, Norma, we're going to have a community health worker pre-app for 2024 funding that opens in the next couple days, but it's only going to fund one community health worker per organization. For the wage part, it's going to be flexible. It has to be at least a living wage, but that's up to the organization, what hourly rate they want to do. So we tried to have flexibility within that to not dictate that. And travel and education and training and other things within that. But, even just with that one effort, trying to get up to 14 org supported, it's $1.5 million, And I know it's like, wait, how does that work? That's just the simple math. So I know for all your staff, like you could use all that money just yourselves, with your one nonprofit. But in our shoes at Dogwood, and my colleague Margarita, I know, is the one that you're working with on those proposals, she needs to think for the whole region as well. And how can we support as many of our community-based organizations as possible? And we've definitely been in dialogue with the state, with the Office of Rural Health. Poor Shannon got my question last Friday. Is the state going to have, any fee-for-service payments for community health workers? Not right now, because they can't afford it. But we are hoping for sustainability to do our part. But I have no quick fixes.
Thank you, Hannah. Well, one of the things you mentioned, Norma, that I think is really important is the ongoing collaborative relationship. And those of us who are in positions to collaborate with the nonprofits and to work with you, as well as other community grassroots organizations, our role to play in being a part of that and connecting and working together. Thank you.
Hi, Dan Frame with ABCCM. Thank you all for sharing your time and expertise. I'm curious your perspectives on the people who are going to still be left out. So we are going to be covering, closing a huge gap, 600,000 people. That's great. The North Carolina Association of Free and Charitable Clinics estimates another 700,000 will still be uninsured and ineligible. So there's going to be new gaps, new ways and new issues. And so I would love your thoughts on how we anticipate repositioning ourselves, covering the gaps, covering those 700,000 lives that are still going to be ineligible for services. I would love your thoughts.
I can start. One of the things that our team is looking at doing is to travel the state and have sessions where people are telling us what is working for them and what is not working for them. And over the course of that time, create what would be called a legislative agenda for the people, and then take that, what we learn from people, and then our relationships in Raleigh, and push for those things. I mean, what I believe in is that the day you're born, you should have access to health care, So for me, Medicaid expansion is a baby step to having care, universal health care. So everyone gets it. Everybody in, nobody out. But, so that's what our first step is, to just come to the people. Would love to connect with you and find out what are the needs, what are the gaps, create that agenda and say this belongs to the people, and to Mr. and Mrs. Lawmaker, this is what your constituents want. And so push in that way.
Thank you so much for bringing that up. We'll still need our safety net system, 100%. Folks that are undocumented aren't going to be eligible for Medicaid, right? No matter how much they make or don't make. And then we also have folks who may be eligible, but who are not going to apply. My family background, there is so much stigma against applying for public assistance. My grandpa was fully disabled after World War II, and he disenrolled himself from disability dozens of times. Even though his wife had 2 twin boys and they were living in a shack, and she's like, quit doing it. But the family pressure to not have any assistance was so huge. Even his veterans benefits, he didn't want, he kept rejecting them. So that is also part of the culture of Western North Carolina, is we do it ourselves, we take care of it ourselves, we don't use government help. So there are going to be people who won't want to apply, and some of it you can, try to educate, try to create a culture where it's okay to have each other's backs. That's an okay part of your life. But again, we are going to have those challenges. We're going to need safety net support, and that's something we're working with at Dogwood, is trying to strategically think with limited funds, how can we support our safety net, our free clinics, and then our FQHCs.
Yeah, I just wanted to add to that. Whoa. I think it does come back to how do FQHCs and the free and charitable clinics continue to partner. From being out of state, North Carolina is blessed to have the strong infrastructure on free and charitable clinics. It's not like that in any other state. So I go back, Hannah is right. It's our safety net providers. How do we continue to partner together, but how do we also legislate or advocate? In Washington State, how they addressed it is they put aside an uninsured fund to help pay for some of that coverage for those folks that were not going to get it. It's just also think about that person who may be at 139% of poverty or 140% of poverty, still may not be able to afford an Affordable Care Act health plan, even with all of the subsidies. So there's still going to be that gap. And I think it's how do we continue to work together, and how do we work with our hospital systems to continue to be able to help provide some of that, the charity care or the uninsured, or putting a pool together. So it's a continuation. It's gotten some best. We're getting better, but there's still going to be, until we get to universal health care for one and all.
Thank you, Kim. I think that we are at the end of time. We've got one more question. Okay. Time for one last question.
Thank you. I'm grateful for all of you being here and in this room, and I think as some others have spoke to, the passion that we bring to serving our neighbors and folks in our communities. I just wanted to briefly speak to or ask about, I think as we all know, poverty and lack of access to health insurance doesn't exist in a vacuum. Social determinants of health, folks who are in the LGBTQ community, folks who don't speak English, folks who have many different barriers to accessing Medicaid, and then once on Medicaid, getting the care that they need. I wondered if anyone wanted to speak to how do we specifically meet folks in those situations and make them feel welcome.
I'd like to start with that.
Yes.
So I'm from here, but I lived in Kentucky when they expanded Medicaid, and I remember meeting people, and all over the news at that time, meeting adult people who, for the first time in their lives, they had health insurance. Not Medicaid, but just health insurance, and having no idea how any of that worked. And so I think in our program specifically, I only want to speak from the ombudsman perspective, a lot of times what we do is accompaniment. So we sit on conference calls, three-way phone calls, we help explain people, these are your benefits, this is what it means, this is how you access. If you don't know the right questions to ask, we're gonna sit on the phone with you to help you through that. I can't say that we can meet every single person who needs that in the state, but that is something that we really try to do so that if someone has that coverage, they are able to use it. Because we know a lot of people who, even now, but also after expansion, people who are gonna have coverage are not gonna know what that means or where to start. So I really appreciate your question. Thank you, Haven.
Thank you, Christy. Nicole, were you going to add something briefly? Go ahead.
Yeah, I think something else that you were speaking to is sort of inequities, so we understand that all of the systems that we operate within were created at a time when it was intentional that there would be some folks who are going to be marginalized and be behind, and those beliefs are baked into policies. And so that is why we want folks to connect the dots between a decision maker and then the policies that come out. And so one of the things I want to share is that Medicaid expansion, half of the people who are in the coverage gap are people of color. And so this is one of the ways that we tack inequities by doing this. But I also think we have to be honest about the issue of inequities and how they exist. And so I think, you know, just every day, just talking to people and understanding their perspective and taking them in every room you go into just helps. And so whatever I can do to make someone feel comfortable makes sense for us. So 2 of the folks on our team, we're a policy group, but they actually are navigators. They have been through the program, and so in our meetings, we want to be able to help people enroll. We want to not just be the policy people, but we want to be the engagement, the communications people, the community people as well.
Thank you, Nicole. It wraps up our time for audience questions, but as I'm just reflecting on what we were just talking about and several of the questions, it really comes back to we still have a lot of work to do. This is an important moment. There is a lot at stake, and there's a lot more work to be done. So I look forward to being a part of that with all of you. I want to thank you all for great questions. I want to thank our panelists for such a rich discussion, for all of the work that you all do in our communities. Let's give them a round of applause. And I would now like to invite up the Honorable Terry Van Dyne, former North Carolina State Senator. She is also a board member of both Pisgah Legal Services and the North Carolina Justice Center. Terry is going to offer us some closing remarks.
Thank you. I can't tell you what a privilege it is to be in a room full of people who care so deeply and work so hard for the good of their community. Thank you, thank you. So on one of my drives to Raleigh, I was listening to NPR, and they were doing a program about Charles Dickens, and in particular about how his novels, they talked about how debtors' prisons condemned families to poverty for generations. And the connection, that just kind of blew my mind at the time, because it made clear the connection between health and poverty is profound, and it is straightforward. If you are too sick or suffering and you can't afford to get help, how can you be expected to work and provide for a family? It is just not possible. And that fundamental truth was obvious at Pisgah Legal Services. I was on their board 10 years ago. They were vocal advocates of Medicaid expansion at a time when advocacy in the nonprofit community was pretty controversial. And they were not alone. Winches, Manna Food Bank, so many of the organizations represented here and across the state, they were there day one, and they stayed there for 10 years, making it obvious to the General Assembly that they just need to do the right thing. But I want to particularly thank the North Carolina Justice Center, not just because they work statewide to build these coalitions, but Nicole Dozier goes into rooms you couldn't pay me to go into. She has been a daily presence at the General Assembly, just explaining to them why this is so important and what they need to do for the people of North Carolina. And I want to thank the the North Carolina Department of Health and Human Services. I mean, you have no idea how difficult a job they had to do working with, I wasn't going to say this, but I have to, a relatively hostile General Assembly to implement and manage care in a way that had compassion and created a path for Medicaid expansion. I don't know how they did it, but I am so grateful. And finally, I want to thank all of you. Each and every one of you, you showed up for rallies, you wrote and emailed and called your legislators, and you generously supported the groups in this room so that they could do this important work. You never gave up, and I can't tell you how proud I am to be with you today. So take a moment to celebrate what you've accomplished. And what have you accomplished? Okay, so, 10 years ago when we started this journey, we estimated that expansion would provide roughly 500,000 people with health care, and that it would create 50,000 jobs and would actually avoid about 1,000 deaths a year. Now, though, with 10 years of experience, we know those numbers not only were justified, they were actually kind of low. And in fact, there are lots and lots of other tangible benefits that come from Medicaid expansion. In states that expand in Medicaid, people report that they feel healthier. They're better able to manage chronic conditions, and they're more likely to have a personal physician. Mortality rates are lower in expansion states. And more poignantly, infant mortality rates are lower in expansion states. Healthcare access has improved for some of our most vulnerable populations, like veterans, people who live in rural communities, the incarcerated, people being released from prison. Can you imagine the impact on recidivism if people leaving prison could have access to mental health care and addiction treatment? On day one, as Dr. Dollar pointed out, we will enroll 300,000 North Carolinians for Medicare, and that number will double because of the work that will be done by organizations fueled by generous contributions from the Dogwood Foundation and other foundations and individuals like you. The uninsured rate in North Carolina will be cut in half, and that will move the needle on poverty. Unfortunately, as you have heard, we're not quite there. We need a budget that works for everyone. The Justice Center tomorrow is going to do a press conference in Raleigh. If you have a story about your experience in the coverage gap, Nicole has left her card, and I've left some brochures. If you're not already getting their alerts, there's information on how to sign up for them. Their website is ncjusticecenter.org. Yes, and watch for your email, because Pisgah Legal will be sending out information on how you can stay involved and continue to fight this fight. Like we've said, there is still a lot of work to do, but know, please know, how grateful I am to all of you for all you've done, for all you continue to do. Thank you for being here, and enjoy the rest of your day.